Good afternoon. We're going to wait until a few people file in and then we'll start the webinar today. There are only a few people in, so I can see the numbers are going up. So that's terrific. And then we'll start in just a few minutes. Thank you for coming. Well, I can see that there are a lot more people here now. So we're going to start the webinar. Good afternoon and welcome to Sensible Financial Planning's webinar series on older adult living. I'm Carrie Fristow and I'll be the moderator today. Today, Sensible's founder, Rick Miller, and financial advisor, Laura Williams, will be talking about long-term care and long-term care insurance. Rick Miller holds a PhD in economics from the University of Chicago and started Sensible Financial 20 years ago this April. He is also a certified financial planner. Laura Williams has a degree in finance from Bentley University and holds both the certified financial planner and the chartered special needs consultant designations. She has been with Sensible Financial for nearly 8 years. This, as you might know, is a 4-part webinar series. The first, which we did in January, was about housing issues for older adults and potential solutions. And it's available for viewing right now on the Sensible Financial website at sensiblefinancial.com/webinars. Today's webinar will address long-term care and long-term care insurance. And next month, in March, Rick and Laura will review housing options with an emphasis on their financial implications. In April, they'll look at continuing care retirement communities, or CCRCs. You can register for any of the upcoming webinars through a link in Sensible Financial's February newsletter, which comes out later this month, or at sensiblefinancial.com/webinars. Also, we will be emailing all of the people who registered a copy of this webinar as soon as it's uploaded. Rick and Laura will answer questions twice today during this presentation, once approximately midway through the webinar and once at the end. Please submit your questions through the Q&A link at the bottom of your window. You can type them in there, and Rick and Laura will answer as many questions as they have time for. Finally, at the end, we will display contact information for Rick and Laura so that you can contact them with your questions. Now, take it away, Rick.
Thank you, Carrie, and welcome everyone. Older adult living options is a very broad area, and even though we're presenting 4 webinars, we're just scratching the surface. Laura and I hope that you will take away 3 main ideas from the 4 webinars. First, while each person's and each family's experience will be different, those experiences will likely fall within a somewhat predictable range. That broad predictability offers families and their members an opportunity to plan for a relatively small number of general contingencies. When specific situations then arise, people and families will be better prepared to respond effectively and to achieve outcomes that they're happier with. Second, the path of least resistance when people need help is for family members to provide it. This can have a lot of advantages, some of which we'll discuss today. There are also significant costs. Providing that kind of care is a big responsibility, and it can be exhausting with long-term consequences for the caregiver. Managing that commitment can help families maintain their own health and well-being and prevent the caring commitment from taking over the entirety of their lives. Finally, for Laura and me as financial planners, a major point, long-term care is not 100% an additional cost to be dealt with if the need arises. Every financial plan can adapt to supply some resources to apply to long-term care. Many planned expenses will be lower if someone needs long-term care. Okay, so now let's move on to discussing long-term care and long-term care insurance. Everybody knows that older people are different from younger people, but what does that really mean? I've looked pretty hard for data to answer that question, and I couldn't find much that was really very accessible. I did find some quantitative work, and I've summarized it as best I can. And this chart does that. And note that it says conceptual perspectives. So there are lines on the chart and they look very precise, but I'm focusing on the general trends and tendencies. And no surprise, as people age, they're less physically active and strong. And I can tell you that I've noticed this. I played soccer in college, and the last time I played soccer was in my 50s, and I couldn't imagine playing now. And I vividly remember when I was on the town 50+ team, scrimmaging the 40 pluses, the guys that were between 40 and 50, and they were much fitter than we were. And it was extremely challenging. And that's just a little bit of example there about physical strength and how that changes over time. One can say that as a positive for aging, that crystallized intelligence, life experience, and wisdom grow. And vocabulary also grows and continues to grow. So there are capabilities that improve and capabilities that decline as people get older. And these are trends, but I'm sure, as you know, there are ranges. If you think about your own family and your own friends, there's a great range of experience as people get older. Some people have a good deal of difficulty and others have very little difficulty at all. It's also true that certain kinds of illness become more prevalent. And again, this data is suggestive, but I would encourage you not to place too much weight on it, because it's gathered from different sources at different times. But in general, there are certain kinds of illness that become more prevalent as people get older. Again, this is far from pervasive. And again, I think it's important to think about your family experience. And I've thought about this just a little bit. There were 8 people in my parents' generation in my family, aunts and uncles, as well as my parents. And of those 8, only 1 suffered from dementia. So dementia is a potential concern, but it doesn't strike nearly everyone. Now, if we think about how this is relevant to older adult living and to long-term care, I would just point out that some illnesses require more help than others do. And some illnesses imply frailty and less ability to manage activities.
Okay, so we're going to talk today about long-term care. And when we're talking about long-term care, we're not specifically thinking about medical care, but we're thinking about help with daily activities. In the next few slides, we're going to describe the difference between activities of daily living and instrumental activities of daily living. If you have a long-term care insurance policy, typically in order to start receiving benefits from that policy, you need to be unable to perform 2 or more of the activities of daily living or have a severe cognitive impairment. And as Rick just talked about, capabilities change over time, as well as illness incidents, but the link between that and long-term care is indirect. All right. So let's talk about what long-term care is and whether insurance benefits might be available. Activities of daily living are fundamental skills that are required for you to take care of yourself independently. So the examples listed below: eating, bathing, dressing, transferring, toileting, and continence. If you're unable to perform 2 or more of these, that's when you'd begin to qualify for long-term care insurance benefits if you have an insurance policy. Having a severe cognitive impairment would also qualify you for benefits. And examples of a severe cognitive impairment are shown below: short or long-term memory loss, difficulty orienting as to person, place, or time, difficulty with deductive or abstract reasoning, and poor judgment as it relates to safety awareness. Okay. Instrumental activities of daily living are different than the previous activities of daily living that we went over. They're still activities that you need to do to care for yourself, but they're a bit more complex and require some planning and thinking compared to the regular activities of daily living. And while you may need help with these activities to care for yourself independently, this type of assistance does not qualify you for insurance benefits unless it's accompanied by 2 activities of daily living or a severe cognitive impairment. So examples of instrumental ADLs include shopping, housekeeping, accounting, food preparation, transportation, a bit more complex than the regular activities of daily living.
And I would just add here that when people talk about long-term care, there is the insurance definition, as Laura suggested. And then, but long-term care is a broader term, and it refers to help that people need with instrumental activities of daily living or with their daily lives. And a lot of that will not qualify for long-term care insurance. And Carrie, we can pause here for a moment and take questions if people have them.
Okay. Well, here's one. Let's see. Okay, here we go. Somebody's raising his hand. Let's see if I can get him. Oh, can you address Parkinson's as a case study?
That is a tough question. I am not enormously familiar with Parkinson's as a disease, and I think that if you were to think about Parkinson's, there are, first of all, there's a wide range of illness with Parkinson's. As capabilities decline, but it is progressive, and as capabilities decline, people tend to need more help. And they might need help with some of the instrumental activities of daily living. So let's go back here. So they might need help with, let's say, housekeeping or food preparation. But they might still be able to manage the regular activities of daily living. So they might need help, and we'll talk toward the end of the discussion about the kinds of help that are available, but still would not qualify for long-term care insurance benefits. But then if the illness progressed further and they needed help with 2 of the activities of daily living, or with, and I'm not, my recollection is, I'm not extraordinarily familiar with Parkinson's, but my recollection is that cognitive impairment is less of an issue here. But the activities of daily living might be problematic. And at that point, if the person was incapable of 2 or more of these, then long-term care insurance would become available.
There's a question from Joseph. Who determines whether the ADL criteria are met? Is it the insurer? And is there an appeals process?
The insurer must determine whether the criteria are met. And they do that by reviewing medical records. And one makes an application for benefits and submits medical records, and then the insurance company makes a determination, and yes, appeals are available. There is an appeal process.
Oh, that's great. Someone has this question. They have a policy. What protects you against the bankruptcy of the company or something going wrong with the entity with which you have the policy?
That's an excellent question. There are state insurance collaboratives or collectives that are, and when I say state, I mean individual states of the United States. Insurance is regulated at the state level and not at the federal level. So the insurance collaboratives at the state level would step in to cover some or all of the benefits.
Okay, let's see if I can find the others. Okay. Oh, there's another one. What's the optimal age to purchase long-term care insurance, and how much insurance should you get?
We will talk a lot about how much insurance to get later in the discussion. In terms of the optimal age, that is a very difficult question to answer. I've seen, and this work is now pretty dated, but if you look at because the premiums rise with age, with starting age. So if you start, let's say, at 50, the premiums would be lower throughout your life than they would be if you start at 60, say. And the present value of the premiums when we looked at it was about the same. So there was no benefit to waiting to start in terms of total lifetime cost of premiums. If you wait a long time, then you may not be able to get benefits because there are underwriting requirements, and or you may not be able to get a policy because the underwriting requirements are pretty stringent, and it might be that if you wait too long, you develop a condition that would cause the insurance company to not be willing to offer you a policy.
Great. Maybe we can, you can save your questions until the end, because there's going to be another Q&A at the end. And if you could put them in the Q&A as opposed to the chat, that would be ideal. Thank you. And
Okay.
now back to the presentation.
Okay, so we'll move on now. How likely is it that someone will need long-term care? And I want to emphasize that we are not actuaries, we're not long-term care actuaries, and we're not deeply steeped in the data. And when I've talked to actuaries about this, people who study the incidence of things like long-term care, there's not a simple answer, but we can look at data that's been gathered by the federal government in the National Long-Term Care Survey, and we can get a sense. This is national survey data, and it's from 2004, which is a little bit old, but the previous survey was in 1984. So perhaps we'll see new data in 2024 in a couple of years. But right now, this is the most current that I could find. We're looking here at, and this is a complicated chart, so I'm going to spend a little time explaining it, and then we're going to see some additional, we'll look at it in a little bit more detail. On the left, we have a panel for men, and on the right, we have a panel for women. And we're looking at, by color, the amount of help that people need, or the amount of disability that they have. So the dark blue at the bottom is people that are well and don't need any help, have no disabilities whatsoever. The light purple here and here represents people who need help with one instrumental activity of daily living. So remember, that was shopping and housekeeping and that sort of thing. The light green represents people who need help with one activity of daily living. So that was one of those important personal activities, such as being able to feed oneself. The light gray is for people that need help with two activities of daily living. So from here up are people that require long-term care according to the insurance definition. And as we go up then, the yellow is 3 activities of daily living. The orange is cognitive impairment and 2 or more activities of daily living. And the red is people who would qualify for long-term care insurance just because they have a cognitive impairment. And just looking at this, this is the 2004 data. You see that as people get older, the biggest trend on the chart is that as people get older, they need more help. But you also see that the portion of, or the proportion of people that qualify for long-term care is relatively, this is for people that are 90, I'm sorry, I should have said, here on the vertical axis, we have percentages. So 100% would be everybody and 0% would be nobody. And on the horizontal axis here, we have age ranges. So these are people between 65 and 69, 70 to 74, all the way up to people who are 95 and older. And as the big point here is that as people age, they need more help. Men and women are different, but not that different. Men are slightly less likely to need care early and more likely to need care later. Something that's not on the chart, but which is a fact, is that men on average don't live as long. Now, importantly, these are probabilities. Life is full of surprises. So it's unpredictable who will need care, what care they will need. I would add also that there's a lot of, there is sometimes an unwillingness on people's part to recognize that they need help. And that's something to watch out for, both in your family and I would suggest in yourself as well. Now, we're going to show that care needs have been declining over time. And this is the same chart from 1984. So the survey that was done in 1984. And again, we have the percentage of people needing care from 0% to 100%. This is men. And then 65 to 69, 70 to 74, and so forth. Notice that at 95 plus, almost everybody is needing care here. And the proportion of people that need long-term care is getting close to 50%. Now let's do our time-lapse photography here and see the trend. And you'll see now this is 2004. And you notice that the proportion of people needing care shrank at every age and for every category. So, and importantly, less insurable, a good deal less insurable long-term care is needed, even at age 95. So this is good news. We don't know whether this has continued, but personally, I would say that I have the sense that it has, and there's a sense that fewer people are requiring long-term care and fewer people are spending time in the most in the kinds of places that provide the most care. Now, I would suggest that thinking about what's happening in your friend group and in your family group is not helpful in terms of figuring out probabilities, because this is a very big change over 20 years. And so trying to forecast exactly what's going to be the situation when you're thinking about whether you might need care or not and what the probabilities are, I think it's very difficult to project because these data are for very large groups and your friend group is a relatively small one. So while we can think about trends, and when we try to bring those trends down and personalize them and think about what they mean for us, my view is, and I would suggest that it helps us think about what we might need to prepare for, but it doesn't tell us, I should say, what categories of things we might need to prepare for, but it certainly doesn't tell us which one. Now, let's look at the same thing for women. And you see here that in 1984, that well more than 50% of women 95 plus needed long-term care according to the insurance definition. Now let's do our progression here. And again, there's a substantial decline in the percentage and proportion of people needing care, but still 30% of women in their early 80s, so that would be here, 30% of women in their early 80s need some sort of help, and 10% need insurable long-term care. And by the time they reach their early 90s, more than half need some kind of help, and 30% need insurable long-term care. Okay.
All right. As I'm sure you're familiar with, you can receive long-term care in a number of different settings. You could choose to receive the care in your home or in your community, at an assisted living or Alzheimer's facility, in a nursing home, or in a continuing care retirement community. And CCRCs typically offer independent living, assisted living, and nursing care all in one location. And they're equipped to help make those transitions easily over time as your care needs change. Okay. There's 4 different ways you can think about funding the care that you might require. You could choose to have family deliver the care to you. The advantage in this situation is that the people providing care to you are familiar to you, and it can be less costly from a financial perspective. Importantly, there's a big disadvantage here for the person providing the care. It can be very burdensome for that person financially, physically, emotionally. You could choose to self-fund your care. That would allow you to have more control over the quality of care that you're receiving, because you can make choices about where you want to receive the care, who is providing the care to you. There's a risk in this situation of depleting your assets prematurely, especially if you require a lot of care, or if you choose to self-fund, this could potentially leave less to your heirs than you might wish to. Medicaid is a resource that would be available for individuals with low income and low assets. There's specific financial requirements that you need to meet in order to qualify. In this situation, the financial burden is transferred to the state. The disadvantage here is that there's potentially lower quality of care. Not every facility accepts Medicaid, so you might not be able to get the care in the place that you'd like to receive it. And the last is long-term care insurance. Having long-term care insurance, the advantages are that it can help preserve retirement assets if you need care. It can also offer you peace of mind knowing that you have this in place and there's a plan for those expenses when they arise. It also means that you are more likely to seek the care when you need it. You've been paying the premiums over time, so as soon as you can receive those benefits, as soon as you qualify, you're likely to claim them. The disadvantage with long-term care insurance is, like with any kind of insurance, you might pay the premiums over time and never qualify or be able to claim the benefits. Okay, so we'll talk a little bit about long-term care insurance policies. They're a little complex, and we're going to talk about how they're structured. So when structuring a policy, you first select a maximum monthly benefit and how many years of coverage you'd like in the policy. Those 2 decisions determine how big of a pool of benefits you have. So you're able to select an amount per month. For example, you could select $5,000 as a monthly benefit, and you could select a number of years as your benefit period. Let's say, as an example, you choose 5 years. 5 years is currently the maximum benefit period available for purchase today. Some people that have purchased policies many years ago have been able to get policies that provide more benefits. I think the most generous policy I've seen provided unlimited years of benefits. Unfortunately, those are not available for purchase today. The idea here with the pool is that it cannot be spent any faster than the monthly benefit that you select, but it can be stretched out longer. So say in the example, if you purchase a policy that offers you $5,000 per month in benefit, but your care only costs you $3,000 per month, you'd be able to stretch the policy out over, instead of 5 years, it would last you over 8 years. Additionally, with these policies, you can select some riders. So you can choose to have your benefit increase over time with an inflation rider. And there's also a rider called a shared care benefit, which would allow for spouses to share the pool of benefits with each other. So if one spouse needed a lot of care, they could borrow benefits from the other spouse. All right, so next let's think about the cost of long-term care. And we're going to use a conceptual chart to help think about how much you might want to purchase in terms of long-term care insurance. We start by thinking about the sticker price for different levels of care. And here we're looking at 3 different potential care situations for a single individual: requiring nursing care, assisted living, or a few hours of home care per day. The first line here shows you the average cost for these levels of care in Massachusetts. Costs can vary based on location. So these costs are taken from Genworth's Cost of Care survey. They provide information about national average cost of care by state and by city. So if you're interested in finding these costs for where you are, you can search for Genworth Cost of Care survey. We start by looking at that sticker price, and we next think about what areas of spending might change if you were to require care. So if we start by thinking about the first example, an individual requiring nursing care, it's very likely that if someone were to require nursing care, they wouldn't be doing much in terms of what we planners call consumption spending. You can think about consumption as discretionary spending or day-to-day living expenses. In this situation, the cost of nursing care is covering a lot of your day-to-day living expenses. All your meals are included, as an example. If you move to a nursing facility, it's also likely that you'd sell your house and you wouldn't have to pay for any ongoing expenses related to your home. So on the first column, we have the sticker price listed, $162,000. And we're estimating how our spending might change if we require that kind of care. There'd be less going on in terms of day-to-day expenses. There's less going on in terms of outgoing housing expenses. And so we think about the net impact in terms of the plan. There's about $81,000 of additional spending going on if you were to require nursing care. And you can follow kind of along with the other 2 levels of care here. There's different impacts to spending. If you require assisted living, there's still some day-to-day living expenses going on, but you're also moving to an assisted living facility and you wouldn't have your ongoing housing expenses. With home care, you're still doing a lot of consumption spending or day-to-day spending. There might be some savings. You might be going out a bit less. You might be a bit less active than you were previously, but you're not saving on your housing expenses because you're still living there. So when we think about how much long-term care insurance might be appropriate, we're focusing on that middle column, the annual gap without long-term care insurance. So this amount is how much extra would it cost beyond what is already included in your financial plan. So in the next line, we've listed an example of a long-term care insurance policy. The policy we've illustrated assumes a $5,000 per month benefit, and it would pay over 5 years. So that totals to about $60,000 a year. And the line below that represents the gap, if any, after accounting for that long-term care insurance policy. So you'll see that long-term care insurance policy would cover a substantial amount of home care and assisted living beyond what your plan already included. And there'd be some additional gap if you were to require nursing care. And the years covered attempts to illustrate how much those policies, how many years those policies would cover for these various levels of care. In this situation, for the nursing care, you might remember the benefits can't be paid out any faster than that $60,000 per year. So if you required 5 years of nursing care, the policy would cover about 3.7 years of that care. But with assisted living and home care, you don't need as much on a month-to-month basis. And so you could let that policy stretch out over a longer period of time. And that could cover extensive assisted living expenses and many years of home care expenses. Okay. And then one last piece about the structure of the policies. From a premium perspective, it's less expensive to purchase policies that are long and thin. And long and thin relates to the structure that you select for your policy. So the amount of benefits and the year of benefits. The example shown below shows two policies that have the same maximum pool. So one is a policy that pays $4,000 per month in benefits over a 5-year period. The pool is $240,000. The other policy is one that pays $6,700 per month in benefit over a 3-year period. And it also covers a $240,000 pool. Same pool being offered, but there's a restriction in terms of how quickly that money can come out. So from an insurance company's perspective, they say it's less likely that you're going to need 5 years of care than it is that you will need 3 years of care, and they price the policies accordingly. From a risk perspective, a longer term care period is a much more expensive kind of catastrophic risk that you want to protect against.
Another way to say that, or a different perspective, would be to say that many people could afford a year of care or 2 years of care, but 5 years of care would be very challenging. And we'd rather spend the premiums to protect against that longer length of stay than to protect against a shorter length of stay, which would be much more affordable anyway. So we're trying to protect against the big risk.
Okay, and there's other kinds of help that you might need, and we've discussed a little bit of this already. That is not necessarily insurable using long-term care insurance policies. Things like meal preparation, transportation, housework, money management. And so there's people to think about in terms of who might provide that care to you. Unpaid caregivers are an option. Home health aides might be able to help. And there's professionals that you can hire. And more often now we're seeing resources like gig workers and online shopping as ways to also help with these types of help.
And something that perhaps we should have said at the very outset is that long-term care, while it's got the word care in it, is largely not healthcare, and it's not covered by Medicare for the most part. And that's why we think about special insurance for it. And that's why also you see all of these providers, very few of whom are healthcare professionals. Okay, so at this point, we'll take more questions.
Great, and there are a bunch. So Rob has asked, what about long-term care insurance premium increases down the road? He's heard of premiums doubling after you've been paying for 20 or 30 years and are on the cusp of needing care.
Mm-hmm. Yes. Yes, that in general, when we plan for long-term care insurance premiums, we project them to grow with inflation. And we have, in the past, we were projecting 2% a year for inflation. And the increases that we have seen in our experience have been pretty consistent with that. And I would say that even for policies, let's say that were purchased 20 years ago, and the premiums are doubling, and that's a large increase. But if you said 2% a year for 20 years, that would be 40%. So that's pretty close to staying constant in real terms. So that's the first thing I would say. And the second thing that I would say is that even with the doubling, if you compare the premiums that would be paid after the increase to premiums of policies being issued today, you would find that the ones that were bought 20 years ago are still a bargain. They're much less expensive than policies that are being issued now.
Okay. Someone asked, please explain the pros and cons of hybrid long-term care insurance and cash indemnity versus reimbursement plans.
I will speak, I think, primarily to the hybrid plans. In general, when one buys a policy that combines benefits for two risks, it's very difficult to compare them and compare their cost to the products alone. So and I would say that the hybrid policies I have seen have not impressed me in terms of the coverage that's available for the long-term care risk. So in general, when people look at long-term care insurance, we're recommending that they look at the specific policies, specific long-term care insurance policies. Now, long-term care insurance policies are expensive, and one might say, well, it's too expensive, I can't afford that, but I can afford a hybrid policy. I think it's important to look very closely at those policies to see just how much long-term care insurance is there. You may find that there's less than you think.
Okay. Does the Maxify software incorporate things like age and needs graphs to help make risk-informed decisions? He's also saying, clearly some needs will be financial and some will be softer, like family help and things like that. But
in general, we find that we have to build scenarios that are specific to the situations that might arise. The software itself does not have, if you will, a long-term care module. So we'll to stress test the plan, we'll build in a certain amount of cost of care to see just how much the plan can support. In terms of the softer question, I've not seen any software that is helpful with that. There, I think consulting with professionals who are familiar with the needs for long-term care assistance is very helpful.
Someone else asks a question about CCRCs, asking what the best source for CCRC ratings is. And I will say that we are doing a CCRC webinar in April. So
let's defer that question till then.
Yeah. One of the attendees asked this, is the decline in long-term care need a reflection of, actual, healthier populace, or that insurers are getting tougher in determining eligibility?
The decline in need that I showed was not insurance-based and not carrier-based. It was based on a survey of the population and an assessment. I do not know, but I would suspect that it's a self-assessment of need or a family member assessment of need. It's not an insurance carrier assessment of need. So I think the data are telling us about something that's real that's going on.
Okay. For those with a lifetime cap in their long-term care insurance, how should we think about going on claim as soon as we can versus keeping our powder dry for now and then and going on later when your care needs and your costs will be higher?
Well, you can always save the benefits. So I would say claim as soon as you can. And in terms of keeping your powder dry, you can just put them in a reserve fund if you like. But waiting to claim risks not getting as many benefits. I wonder if I could say that differently. So suppose that we could see in advance how many years of care we might need. In a lot of cases, even though it starts slowly, we might need only, let's say, 3 years of care. So if you wait out that first year to, quote, keep your powder dry, then you might get only 2 years of benefits. Whereas if you claim immediately, then you're going to get 3. So starting early allows you to get access potentially to the most benefits. So I would recommend that.
Joseph wants to know, is there a national average for the length of stay in a nursing home that you know of?
There is. And I guess the point that I would make is that it's a, first of all, it's a what's called a conditional length of stay, right? So it's conditional on needing to stay in the first place. So you have to apply to that the probability that you'll actually need care. And then secondly, while one might be tempted to say, well, the average is, let's say, 2 years, and I think that the average is 2 years or less, well, then I need insurance only for 2 years. But there's a distribution, a probability distribution of the amount of care that might be needed. And when you buy insurance, you're trying to protect against a long stay, an expensive stay. And so knowing the average is, from our perspective, not as helpful as it might appear.
Can you talk about hybrid policies where unused benefits are left to heirs?
I think with hybrid policies, the way I would encourage people to evaluate them is to think about the two policies that are stuck together to make the hybrid, and to think about whether one can accomplish one's objectives better with two policies, one that's long-term care and one that's life insurance. And so then one can evaluate each one on its own 2 feet, if you will, and decide if that will help you, the combination will help you accomplish your objectives. When products are bundled, I find more difficult to assess them, and people may tend to focus on one aspect or another aspect and miss the fact that one or both of them is not well priced.
Okay, Jen wants to know, are annuities useful to support self-funded long-term care?
I would assume that she's talking about, I would assume that she's talking about an income annuity. And again, I think it's important to distinguish between what we're trying to accomplish with an income annuity, which is to minimize the risk or reduce the risk that you will outlive your income, and long-term care insurance, which pays if you need long-term care but doesn't otherwise. So there's nothing special about the annuity from the perspective of long-term care, because it doesn't pay more if you need long-term care. So an issue with annuities that was that was identified in an academic paper some years ago is that they're not flexible. If you buy an annuity and later you need extra money for long-term care, the money that's in the annuity is devoted to that. You can't accelerate it if you need. You can't accelerate the income if you need more, as you might if you need long-term care.
Okay, let's see. Can you talk about advanced gifting planning or trusts for Medicaid assistance?
Laura, would you like to speak to that?
Go ahead, Rick.
Okay, so there are, as Laura suggested, there are requirements that assets be low and income be low in order to qualify for Medicaid. And one might be concerned that if one needs long-term care, that one might need to spend down one's assets before one qualified for Medicaid. And some people find that to be problematic, and they're looking for ways to avoid that. And one approach is to put money into an irrevocable trust. And we are not attorneys, so I can't speak to the specifics of how those trusts are structured. But my understanding basically is that the person who puts the money in the trust cannot be in charge of deciding when money comes out of the trust. So one puts money in the irrevocable trust. There are trustees that are not the donor who decide when money can come out of the trust. And if the donor then turns out to need long-term care, if what's called a look-back period has passed, then the assets in the trust don't count for us determining whether the person qualifies for Medicaid or not. Now, there is, I mentioned the look-back period, and right now I believe in Massachusetts that's 5 years. And what that means is that if one puts money in a trust like that, but suppose that one did that this year, and in 2 years one needed long-term care, that's inside the 5-year look-back period. And in effect, the person who put the money in the trust would have to cover the number of however much care that the money that was put in the trust would cover before they could qualify for Medicaid. So it's a complex strategy. It requires very capable legal guidance to carry out.
I think one point to add to that is it might not cover every care situation. So Medicaid might provide resources, you know, if you need nursing care, but it might not if you're trying to stay in your home, as an example. There are situations where Medicaid can help with home care, but not every case.
I think there's just one more question. Mark wanted to know if you could speak to the risk of insufficient coverage. Say, for example, if you're purchasing long-term care insurance, but you end up requiring more care than you can afford, even with coverage. Yeah.
It's possible. It's possible. This is something else that perhaps we should have said at the outset. This is the potential need for long-term care is, I would say, from my perspective as a financial planner, it is probably the most vexing, difficult issue to deal with, because it's so unpredictable. The amount of care that one might need is unpredictable. How much it will cost is unpredictable. And the thrust of the question is exactly right. One can buy insurance, but one cannot buy the kind of insurance that we would prefer which is so-called catastrophic coverage, which would allow you to say, well, I'll cover the first 2 years, but then I want coverage to cover however much I need after that. That's just not available. So it is a risk that one really cannot fully insure, and that is, it's very unfortunate, and as a financial planner, it's very frustrating. But we can't fully plan and protect for every contingency. Okay, so I think at this point we'll close the question and answer session, and we'll move on to our summary. Many older people will need help later in their lives, and we can look to anecdotes from our family history and our friend group to help us see this general trends and to remind us that it's not predictable and that there's a lot of variability in how much care we might need. But the range of needs and the range of outcomes is almost certainly wider than our personal experience can help us understand. So getting a sense of the broader risks, or a broader sense of the risks, such as we tried to provide at the very beginning about how many people need care and how much care and so forth, understanding that, I think, can be very helpful. Long-term care insurance and Medicaid will help pay for certain subsets of help needs. So just a reminder that while the activities of daily living help us understand when insurance might cover and when Medicaid might cover, there are other needs that we might have that insurance is not available for. And we need to divert resources from other areas to cover those. And finally, even if Medicaid doesn't pay and long-term care insurance doesn't pay, or even if they pay but not everything, cover everything, and I'm speaking more specifically here of long-term care insurance, many people's budgets have some capacity to accommodate the kind of help that is covered by or meant by long-term care. So the sticker price almost certainly overstates the impact on your financial plan and the resources that one would need to source in order to cover the care that you might need. So that concludes the webinar on long-term care and long-term care insurance. Our next webinar on the economics of housing options is in early March. And the final webinar in this series on continuing care retirement communities will be in April. You can register for the upcoming webinars. There's a link in our, there will be a link in our February newsletter that will be published later this month. If you don't receive the newsletter, you can sign up for the newsletter at our website, sensiblefinancial.com. And there's also a link on the website to allow you to register for the next webinars. Thank you for attending, and we hope to see you at our next webinar.